Right, well, some people needing a COVID test are really having a hard time finding one. Testing sites are becoming busier as more people need to know if they have COVID-19. 2 News Oklahoma's Katie Kelleher is at Bixby Urgent Care, where it's seeing an increase in those being tested for the virus. Katie?
Yeah, people can drive up here at Access Healthcare in Bixby and they'll follow the instructions on this sign and get a COVID test, hopefully all within about 15 minutes. Now, the clinic here is actually expanding the number of testing sites out here because they're seeing such an increase in people needing a test. When you drive up to Access Healthcare, a nurse will give you a PCR nasal swab test, and you should get your results the next day. This clinic in Bixby is one of 5 across Green Country. Krista Ingham, growth coordinator for Access, says they saw a 300% increase in COVID testing and positive cases over the past few weeks.
Before the last 3 weeks, we were only testing about 100 people a week, and right now we're testing nearly 400 people a day.
She says a majority of those COVID patients are 20 to 45 years old, which is younger than what they saw when the pandemic began. As more people are getting tested, finding a test is becoming a struggle for some.
So when people pull up, they are so thankful because they didn't know where they could get tested or how they could get tested, and they heard that the wait times are horrendous. They heard that the results can take 3 to 5 days to get back, and they're scared, they're fearful, and they're scared for their families as well.
Dr. Mary Clark, president of the Oklahoma State Medical Association, says they are running low on rapid tests, but people should still be able to find a test.
But the ability to test, there's a lot of places. It really has just been the ability for the timing for some people, and if you want a rapid test or you want that confirmatory PCR test.
When it comes to those who are getting tested, Ingham says she's noticed another difference since the Delta variant began to spread.
When COVID first came through, we were seeing asymptomatic patients. With this variant, we're seeing a lot of patients with symptoms. It's pretty rare that we have a patient that has absolutely not even a runny nose. Now, the cost of a COVID test depends on your insurance. Now, if you're uninsured, Access can cover that cost using CARES Act funding. However, that varies by business. So if you do need a test, make sure to check what's covered before you go. Live in Tulsa, Katie Kelleher, 2 News Oklahoma.